The Ministry of Health in Jamaica is taking steps to halt the growing number of infections affecting newborn babies that have in some cases resulted in death. The infections have so far been detected at the University Hospital of the West Indies, UHWI, and the Cornwall Regional Hospital. Between the two hospitals, 18 babies have died since the start of the year due to infections from the Klebsiella and Serratia bacteria. Dr. Ferguson, who says he was only made aware of the incidents on Friday, says as a precautionary measure, he has requested that the Caribbean Public Health Agency, CARPHA, be on standby to assist the country in any capacity needed. He adds that assistance has also been sought from the Pan American Health Organization, PAHO, which has sent an advisor on infection prevention and control to the country. That unnamed advisor was scheduled to arrive in Jamaica on Monday, and 2 additional persons are slated to arrive in the island from PAHO within the next few days. They will support activities by the ministry to improve the delivery of service and quality of care at public health agencies.
We already have standard protocols and procedures in place specific to maternity, operating theatre, neonatal units, intensive care, and accident and emergency, MONIA, to guide these practices. In order to strengthen infection prevention and control procedures and practices, the ministry has engaged a medical microbiologist at the central level who is charged with visiting and working with other facilities to ensure that these practices are kept at a standard that is acceptable. We'll be carrying out routine audits from the central level through the Health Service Planning and Integration Division of the ministry to ensure that these practices will be maintained in keeping with the standards. The microbiologist at the University Hospital of the West Indies has also been conducting training sessions with the teams. Foot-operated hand-washing stations are being installed in several hospitals as part of the measures to improve infection control.
Dr. Ferguson says his ministry has been implementing a broader and more comprehensive plan to significantly improve maternal and child health with a focus on reducing mortality.
We know that the majority of infant deaths, or 80%, occur during the neonatal period or the first month of life. 87% of those occur during the first week of life, mainly due to prematurity and other complications of the perinatal period. This is why we have been working towards expanding neonatal and maternal care services to improve the quality of care given to the premature infant and high-risk pregnant women. In light of this, we have begun implementation of the Program for the Reduction of Maternal and Child Mortality, PROMAC, under which Jamaica was allocated 22 million euros, or about 3 billion from the European Union after we wrote and submitted a project which was accepted.
The health minister, in recognizing that most of the island's healthcare facilities are over 50 years old, says the system is to undergo a major infrastructure overhaul to bring them up to 21st century standards through the introduction of new technologies.
This will be achieved under PROMAC, and we expect to have true state-of-the-art neonatal and maternal high dependency units within the next 3 years. The program also provides for training for the staff who will be working in these areas. The objectives of PROMAC include reducing the incidence of neonatal deaths due to inadequate access to high dependency care and reducing the incidence of maternal deaths due to inadequate access to emergency obstetrics care. This component of the project seeks to create a total of 45 beds in neonatal high dependency units at the Cornwall Regional, Mandeville Regional, St. Anne's Bay Regional, Spanish Town and Victoria Jubilee hospitals, as well as the Bustamante Hospital for Children.
Meanwhile, the professional arm of the opposition Jamaica Labour Party Generation 2000 G2K is again calling on Prime Minister Portia Simpson Miller to sack the Health Minister for his mismanagement of the sector. G2K is laying the blame squarely at the feet of Dr. Fenton Ferguson for his continued poor stewardship of the health sector. The group says it is absolutely unacceptable for Dr. Ferguson to tell the nation that he only recently learned about the bacterial infection outbreaks, when it is ultimately his responsibility as Minister of Health to ensure that a proper structure for management and communication of these situations are in place and working. G2K further adds that if Minister Ferguson is to be given the benefit of the doubt in relation to ignorance on the matter, he should at minimum be immediately relieved of his portfolio. G2K asserts that, quote, "This is just the latest incident on Dr. Ferguson's rap sheet of mismanagement, ineptness and disregard for the health and safety of the nation. Time after time, the Prime Minister has failed to hold anyone accountable for the suffering and hurt meted out to the nation under Fenton Ferguson's stewardship," end quote.